Canadians are experiencing a connection crisis, and it's impacting our health and well-being. Research shows that 80 to 90% of our health outcomes are driven by factors like our relationships, stress levels, income, housing, access to nutritious food, education, and built environment like parks. Neglecting our social needs is costing us money. People with a poor sense of belonging are more likely to be in the top 5% of healthcare users. This 5% accounts for more than 50% of all healthcare spending. This problem is urgent. More than 1 in 10 Canadians feel always or often lonely. What's more, this crisis is reflected in our volunteer and civil society sector. Since the pandemic, people are volunteering 18% less, meaning less overall volunteers, less hours, and a nonprofit sector that is struggling to maintain programming or has even had to reduce services. Social prescribing helps us address people's need for connection. Tabby might be prescribed a yoga class to address her symptoms of chronic stress. But what if we could solve our loneliness crisis and our volunteer crisis simultaneously? With community prescribing, we can connect individuals and meet urgent community needs. Noelle is prescribed a spot at a local nonprofit's community garden. Here, she gets to reinvest in her love of gardening, meet new people, and in exchange for her plot, she gives some of her surplus harvest to the nonprofit's grocery program. Jermaine and his social worker find a meaningful way to use his love of movies by prescribing him a spot on the volunteer committee that runs his neighborhood's movie night in the park programming. Here, he feels less isolated, meets other movie buffs, and gets to give back to his neighborhood. Carrie's doctor prescribes her a spot in a book club for older adults after the passing of her husband. The book club alone may be enough to satisfy Carrie's social needs, but her doctor, as a community prescriber, sees that Carrie's love of reading could be used to help her library's early literacy program. In this scenario, Carrie's need to socialize with other older adults is met, and she gets to feel like her skills and experience are making a meaningful difference in the lives of young people. To make community prescribing a reality, we'll need to create a community of practice, design a model, build partnerships, and ensure clear financial pathways. This requires many cross-sectoral partnerships. We'll connect with social prescribing institutes as experts in the field and as advocates who are already reducing barriers to holistic and community-based healthcare responses. We'll work with the volunteer and civil society sector to help us understand what the community needs are and how we can meaningfully create opportunities. Healthcare practitioners will be crucial as those delivering the prescription and as advocates. How can we fund community prescribing? We see 3 main avenues. The first, through insurance, including private insurance and the healthcare expenditures covered by various government policies. As is already being done with social prescribing, we will use the mechanisms of healthcare to increase people's social care. Nonprofits will introduce fees for service, utilizing insurance coverage to help them with the associated costs of running meaningful, engaging volunteer programs. For example, staffing and material costs. And we will seek funding from foundations already backing social prescribing. This funding will be used to create a model of practice and support practitioners who want to become community prescribers. To ensure community prescribing is a successful process social innovation, we must focus on program characteristics, client outcomes, and targeted goals. Cross-sectoral collaboration across healthcare, nonprofits, insurers, and civil society is essential to ensure accessibility for practitioners and flexibility for clients. Success will also require creative, client-centered approaches, as those shown in the examples of Noelle, Jermaine, and Carrie. For client outcomes, practitioners should feel confident prescribing community. HSOs must ensure volunteer roles are meaningful and foster connection. This approach will strengthen community ties and, as demonstrated by social prescribing, reduce healthcare visits. This brings us to our targeted goals of community prescribing being adopted by Casway and other healthcare associations, reducing social isolation and loneliness, increasing volunteer and civic engagement, and reducing the healthcare burden. Invest today in community prescribing for healthier, more connected individuals and communities.
Created using Powtoon.